This is Victoria Smart, and today I'm going to be performing range of motion exercises with my patient. First things first, this is Ted. Everyone say hi to Ted. I am going to verify the provider's orders and check for any restrictions that Ted might have, if he has any pain or weakness, or if he is post-operative, any um, drainage or wounds that he might have, then I would want to make sure that I don gloves during this. I'm going to gather all of my proper equipment, and then I'm going to enter the room and perform my hand hygiene. I will ensure the patient's privacy and introduce myself. Hi Ted, how are we doing? To him as well as his family if they're around. I'm going to ask him, hey Ted, can you give me your name and your full name and date of birth? And I'm going to check that with his wristband using two identifiers. I'm going to explain what we're going to be doing, and as I progress along the body, I'm going to demonstrate and explain what exercises I will be doing and what they will be working for. And then I'm going to assess him and ask him on a scale of 1 to 10, a pain scale, what his current pain is, and I will note that in the record. I'm going to ensure that the height of the bed is adequate for me working, and I'm going to make sure that the bed wheels are locked and that the brakes are on. I'm going to, if there are any skin lesions, like I said, at this point, don gloves, assist him into a comfortable position, providing enough space for him to perform or me to assist him perform the exercises. And then first we're going to do passive range of motion. So that means that I will fully be supporting the joint and assisting him with the exercises. I'm going to complete the exercises from head to toe, moving my way from the top to the bottom. And I will note any signs of and let him know that we don't want to work the exercise to any fatigue or pain or any excess resistance. I'm going to repeat each exercise and movement about 5 times all the way down the body, and then inform him as well as we go through how he could work these exercises into his everyday living. When performing the passive range of motion, I want to make sure that I'm supporting each joint and then also measuring, if indicated, the range of motion of the joint that we are performing the exercise on. I'm going to make sure that I'm standing on the side of the bed of the joint or limb that I am assisting him with. And I'm always going to make sure that I'm only exposing the limb or the area of the body that we are currently working on. So to perform the passive range of motion, we're going to start with the patient's shoulders up top. And I'm going to do flexion, so flexion and extension. And then I'm going to do abduction and adduction, and then I'm going to do horizontal abduction, and I'm also going to do external rotation as well as internal rotation, and then finally circumduction, so all the way around the joint. Next, we would move on to the patient's wrist. So same thing, we're going to do flexion and extension, and then we're going to do abduction and adduction. And then next we would move down to the fingers. So same thing, we're going to do flexion, extension, and abduction, excuse me. And then next we would move downward in the body. So we're going to work on his knees, and the knee is going to be flexion and then extension. Next would be the foot and the ankle. So the same thing is going to be, we're going to do dorsiflexion and then plantar flexion. And then I'm going to do inversion and eversion. And then Lastly, we would explain and demonstrate each exercise. If I'm going to do active assisted range of motion exercises, we want to explain it and demonstrate it to make sure that he properly understands and knows what he's going to be doing. So we're going to instruct him to avoid exercising the joint to the point of fatigue, pain, or excess resistance. I'm going to inform him how these exercises, again, could be used in his everyday living. And then I'm going to instruct him to move the joint slowly and gently, not any jerking movements or too fast or too hard. For active assistant range of motion, allow him to perform as much as he possibly can. If he needs assistance, then I will step in, but see what he can do. Next, I'm going to assist him if he needed any assistive devices. So if he needs a walker or if he needs a towel to hold his arm or any assistive devices. I'm going to measure the joint's range of motion and strength in each area of the body. I'm always going to stand on, again, the side of the bed that he is performing the tasks on. I'm going to reassess his pain as we move along on a scale of 1 to 10. Ensure that he understands the purpose of the range of motion exercise for each area of the body that we are moving through, and asking him to teach me back the techniques to make sure that he understands them. After all of the range of motion exercises are completed, I'm going to help him back into a comfortable position and place all of his personal items and belongings within reach. I'm going to make sure that the call light is within reach and that he understands how to use it in case I need to come running to his rescue. I'm going to raise the side rails once again on the side of the bed that we were working on and put the bed into the lowest possible position for patient safety. I'm going to next perform my hand hygiene on my way out. And lastly, I'm going to document and report any responses or any expected or unexpected outcomes that Ted provided.